All right, let's take this story further now, and also the broader concerns about the state of our hospitals in Gauteng. I'm joined by Buang Jones from the SA Human Rights Commission. Buang, thank you so much for joining us in studio. You know, listening to that story that Mobile put together, the hospital is saying that the little deceased baby just had the wrong tag. But the problem started earlier, and just listening to that story where she says that the nurses and the midwives left her in the care of a male orderly who ran around looking for them, and they were on their phones looking at videos. Then they denied her pain when she told them that she was in pain. And I think that, this is obviously her account, but this is not the first time you've heard these sorts of stories. And I want to know from your perspective, from a human rights perspective, what can you do?
Well, the South African Human Rights Commission is a fully fledged legal practice. We can act on behalf of victims of human rights violations in forums such as the courts, and we can also assist with securing appropriate redress for persons who have been victims of human rights violations. We can act in a representative capacity, and we will be reaching out to the family to see how we can best assist in this matter. We will also embark on a visit to the hospital on Wednesday to get to the bottom of what happened, to see if we can facilitate a mutually acceptable solution in that the family will, on the one hand, find closure, but also the hospital will be able to get to the bottom of what happened and for consequence management to follow.
All right, so you actually have the powers to get this matter to court if there is a case and get some justice for this grieving family, which is, I think, it's some comfort. I know that you've been on a number of visits.
Yep.
You've been to Rahima Musa, where, of course, Dr. Tim de Meyer, the whistleblowing paediatrician, spoke out in an open letter about the terrible conditions.
Yep.
And you're at Chris Hani Baragwanath today. What are you seeing? What is the picture that is emerging of our provincial hospitals?
Well, we are seeing a picture of a crumbling healthcare system, a system that is clogged, that cannot cope, a system that has a deteriorating infrastructure. And the nub of the challenges at Chris Hani relate to infrastructure, the physical infrastructure. The hospital is old. The infrastructure that supports the work of healthcare professionals at the hospital is very old and needs to be replaced. And there are challenges in terms of the role clarification between the Department of Health, the Department of Infrastructure Development, and the Provincial Treasury. And that is why the Commission has determined that there is a need for an urgent meeting with the HODs of these three departments to address all these challenges, which are not unique to Chris Hani. Another emerging issue is the non-payment of service providers who at times refuse to take on more work from the health department because of non-payment. And it's one of the issues that we will address. We do understand that the Public Service Commission is also looking into the conduct of the Chief Financial Officer of the Gauteng Department of Health, and we will also be seeking answers because the actions or inactions of the Department of Health have an impact on the provision of healthcare services in our hospitals.
It's been quite interesting observing the process around Tim de Meyer, because he sent out that open letter, then he was suspended, then there was an outcry from the public and medical professionals. He was reinstated, then allegations that he was actually getting victimized at work. And then last week, this I am letter. And the head of intensive care at Chris Hani Baragwanath is one of the doctors who has signed this. One of the things they're calling for is for CEOs to have the proper financial qualifications. Do you support that? I mean, it seems bizarre that they might not. But do you think, when you talk about infrastructure, it goes to understanding as well when things need repairing, how to budget for that. It also talks about how to budget properly for the smallest issues around equipment, for clean linen, for proper food. So if your CEO and your CFO are not properly qualified and don't actually know what they're doing when they're trying to keep a massive hospital running, it does become a human rights issue, doesn't it?
It does, and but I must hasten to say there are men and women who are very capable who run some of these hospitals, but the challenge has been that the budget holder is the Department of Health, but the implementing agent is the Department of Infrastructure, and that's where there are challenges, and that's where we need the intervention of the provincial government to see to it that they streamline their processes and they fast-track payments. But of course, appointments are also important. You need a very capable leadership that can turn around the healthcare sector in the province, and maybe it's about time that we examine as to whether are these appointments partly responsible for the lamentable state of health.
Are you, as the Human Rights Commission, prepared to call out CEOs who are missing in action? And I'm thinking, of course, of the allegations against the Rahima Musa CEO, who there are reports that she's been working from home for a very long time, that she's been very dismissive of some of the allegations levelled against her and her hospital. If you were looking into that and you found that she's missing in action, would you call people out, name them and shame them?
Well, we have a responsibility. We have a public duty to speak out and to also issue directives. So if we are required to do that, we will certainly do that, to call for consequence management, to call for enhanced accountability and oversight. There's a new head of department now, Dr. Noli Chungu, who we'll be meeting with in order to highlight some of the challenges that we have gleaned from our own investigations as the Commission. And we hope that there will be a decisive leadership, improved governance, and patient care, which meets the norms and standards that have been set out by the World Health Organization and our own National Department of Health.
I want to ask you about, I mean, I would imagine, Buang Jones, that you're not part of the Human Rights Commission without a great passion for human rights. So when you look at the state of our hospital, you say, well, crumbling infrastructure is a problem and budgeting. But if you look at the humans in that system who have no choice but to go to a substandard hospital, how do you feel?
Well, it's quite disheartening. A lot of patients don't have a choice. A lot of people lost their livelihoods during COVID and have had to rely on public health care. So we have to do something as a country. We have to prepare hospitals to ensure that they're in a state of readiness for the rollout of the NHI. And I don't think at this point they are.
Yeah, absolutely. Talk to me about when we can see clear direction from the Human Rights Commission. You are visiting hospitals. When are you going to come out and say, right, this is what needs to happen, and we stand by this, and these are the people we're naming as a problem?
Yeah, we hope to make pronouncements. We are meeting with the three heads on the 13th of July, and I think that is when we'll be in a position to make major pronouncements on the next steps. But we do hope that we'll also be able to solicit commitments and undertakings from the new head of department to turn around the situation in Gauteng, as it is some of these hospitals, by the looks of things, will be dysfunctional if nothing is done.
We've spoken about the patients very briefly. Let's talk about staff. There are allegations that some staff just don't care, but we also know there are so many good people working insane hours to try and turn things around. How do we make sure we hold on to those good people?
I think the hospital management have to really work on building staff morale, but staff morale also requires a good support system and a great enabling environment. At the moment, the conditions require a major overhaul, and I don't think we can fault healthcare professionals who work under difficult conditions. The system at the moment is not responsive to what they would require in order to provide quality healthcare, but we should commend them for still being able to provide services under the current circumstances and conditions.
Gone all through COVID, and now they're having to deal with this. Well, I look forward to what the Human Rights Commission is going to say and do to help solving this problem. Thank you very much for coming into studio this evening. That, of course, is Buang Jones from the SA Human Rights Commission. Let's move to the